All right, as we've been discussing, the Biden administration's Friday night news dump summary of the government findings on the origins of COVID fails to live up to what is required by the law, a law passed by this Congress back in March and signed by President Biden. It was bipartisan. What, if any, information could be contained within the intelligence findings that might alter the way government actors respond to pandemics in the future? With me now to talk about this is Dr. Robert Malone, Chief Medical and Regulatory Officer for the Unity Project, and an internationally recognized physician scientist who specializes in advanced development of medical countermeasures to infectious diseases. Dr. Malone, welcome back to Washington Watch.
Hi, Tony. Thanks for having me on. Interesting topic and interesting times we're living in, aren't they?
It's an understatement. Let me just get your thoughts on the summary report dumped late Friday night by the Biden administration. Did we learn anything from that?
We learned that the intelligence community wishes to play this very cautiously and has put out a document that reads to me a lot like a limited hangout. They are striving for consensus in this document, and they're not representing the breadth of opinions that exist. They're acknowledging that there's some differences, but this is very superficial. And they are taking the position that the initial infections appear to have been in Wuhan Institute of Virology personnel. They're asserting that they came from transfer from an animal origin, presumably at that, although they won't say so because they give various caveats about the nature of the data. And they assert that there is no evidence that this was a biologically engineered virus, which is not consistent with a large fraction of the data and the emerging consensus globally. They make the assertion that this is absolutely not a biologic weapon. And basically, the position in this very short, circumspect document is almost identical to that I heard from Michael Callahan in February of 2020, when he was saying that his people had been all over the sequence and there was no evidence that it was engineered. I think that is no longer a tenable argument, but that's the one that the Biden administration is putting forward in this document.
So, Dr. Malone, from a medical standpoint, I mean, when we have something like this, as significant as the COVID pandemic that spread around the globe, shut everything down, you would think we want to go back and we want to assess, look at what happened, how we responded to it so that we can plan for the future. This lack of transparency, doesn't this handicap us going forward?
Well, Tony, you live and operate in Washington, and what you're speaking of is the best in all possible worlds in an environment in which people are acting in good faith and intending to protect the public. That is not the Washington that we live in right now. This is not Washington, D.C. as it exists right now. Washington, D.C. right now is doing everything they can to cover their mismanagement and malfeasance during the last 3 years of the COVID crisis. And this is entirely consistent with that. I agree that in a world in which our government is focused on its task and its tasks as defined in the Constitution, things would go exactly as you propose. But everything is politicized, everything is spun, everything is propagandized, everything is basically a form of warfare and competition, and the national interests of the citizenry get left behind in all of this scrum. It's shocking and yet entirely predictable. So I agree that would be the way that things should be done in a world in which the government is acting in good faith, but I don't see any evidence of that.
And part of the reason that we may not be seeing that is so that they can protect and guard the power that they exercised over the lives of people. And if we had all the information, we would be able to determine that they misused that power?
Many of us believe that they did abuse power, and that abuse occurred really all across the Five Eyes Alliance nations in particular, also the European Union. But it's there is various theories of the case, and a lot of evidence indicating that government funding, as Bob Redfield testified on the Hill on sworn testimony, a former CDC director, former right hand of Bob Gallo, testified. We had USAID, State Department, NIH, multiple streams of money going into the Wuhan Institute of Virology funding this work. And the documents have been uncovered now, demonstrating that this is the case. Most recently, involving the demonstrating the involvement of Dr. Peter Hotez even. Mm-hmm. So there's a lot of I don't know if we even want to call it smoke. I would say that we have a lot of documented evidence involving the contributions of the United States government, right, directly and indirectly through academia.